There's a little bit of a process as to how we qualify a patient for a dental implant. And that includes looking at the site where the dental implant is going to be placed. There has to be adequate bone there. There has to be adequate, tough, protective gum tissue there. That's the first thing that we're looking for. The long-term success of dental implants is very dependent on site preparation. The options for having a dental implant would include the replacement of a single tooth. It could be the replacement of several teeth in a row, in which case there could be, say, 2 or 3 or more individual implants, or on occasion, a bridge can be placed on, say, maybe 2 or 3 and cover the same length of a span that was covered with individual implants. If someone comes in and they have no teeth, or their teeth are non-savable or non-restorable, then extraction of those teeth is going to be necessary, and many times just to eliminate the infection that's associated with those teeth. They're beyond periodontal treatment. So when those teeth come out and site preparation is part of that, and a certain length of time for healing, then what you might think of as a denture can be either held, retained, or supported by dental implants. It can be as little as 2. It can be as many as 4 to 6 on each side. Those 2 types are removable. In other words, the denture can be taken out and put back in, and the retention is still very much improved over no implants at all. That progresses on to having dental implants where the denture is permanently fixed to the dental implants, and those do not come out. They look like teeth. They function like real teeth.